Hello, this is Richard Riskey on behalf of Group 5, and this is our presentation about the functionality of the electronic health record. Welcome to the electronic health record. This system has been designed as a virtual patient chart that integrates not only the workflow of the hospital or clinic, but also complies with the CMS guidelines for meaningful use. In this presentation, we'll be exploring the functionality of the electronic health record. This is a short presentation designed for health IT professionals as well as end users of the system, and its purpose is to introduce the basic functionalities of the software. So let's begin. The foundation of the electronic health record is the ability to enter, store, and manipulate data. In addition to this basic functionality, we have added clinical support functionality intended to comply with the quality payment program introduced by CMS. This screenshot demonstrates the patient form component of the EHR. As we proceed, we will discuss 5 key clinical support functionalities that we have included into the record and how to access these tools. We have introduced the clinical tools functionality through the use of a button nested inside the patient forms portion of the EHR. This button integrates the support tools by generating reminder messages to the provider based on various aspects of the patient's demographics, such as age or a particular diagnosis. As the provider completes documentation and uses the EHR in a meaningful way, the messages will prompt the provider to perform appropriate care, improving both patient outcomes and reimbursement. In selecting our clinical tools, we have targeted diagnoses and interventions with broad implications for patients' health across multiple areas of healthcare. The first of these is a clinical reminder for annual flu vaccinations. As shown on the slide, influenza impacts over 24 million Americans annually, with another 11 million visits to providers and unfortunately over 10,000 deaths. Depicted here on screen is the electronic health records influenza vaccination tool. As providers work through the patient's chart and click the clinical alerts button in a meaningful use fashion, any patient over the 18 will prompt a provider to check the patient's vaccination status and administer the flu vaccine if it has not already been done. This categorization is achieved through the age demographic on the electronic health record. Our next clinical support tool involves vaccination status against pneumococcus. This is a disease associated with a broad number of illnesses, including pneumonia and meningitis. As you can see, the mortality for individuals suffering from these diseases is quite startling, with pneumococcal pneumonia killing 1 in 20 patients and pneumococcal meningitis killing 1 in 5. It is currently recommended that all adults over age 65 receive an updated vaccination for pneumococcus. As providers use the clinical alert button, they will be prompted to administer the vaccination to all patients who meet age criteria, again based off the age demographics from within the system. The third clinical support tool relates to adolescent vaccinations. The current CDC schedule for youth vaccination are depicted below. Many diseases that devastated the world's population a century ago are virtually unheard of today. This is in thanks to diligent work in obtaining and maintaining vaccination status. Any patient over 13 years of age within the electronic health record will generate a reminder for the clinician to check and complete their vaccination status using the clinical alert button. The next clinical support tool targets patient population with heart failure. Heart failure is another common disease characterized by the inability of the heart to adequately pump blood to support the body's needs. All patients carrying a diagnosis of heart failure in the electronic health record will produce a clinical alert for the provider to obtain and review their annual echocardiograph. This report is an ultrasound imaging technique that allows providers to examine the progression of the patient's disease. Obtaining regular echocardiograms for the patients help track the disease progression and guide medication decisions. Our last clinical support tool in the EHR involves depression screening for patients with known suicidal ideation. This graph depicts the trends in suicides across the United States from 2016. Many public health experts believe that suicide and depression are a public health crisis requiring the same attention and efforts as obesity, heart disease, diabetes, and cancer. When a patient carries a diagnosis of suicidal ideation or history of a suicide attempt within the electronic health record, the clinical alert button will prompt the provider to conduct routine mental health screenings to monitor depression and adjust medications. Thank you for your attention during this brief introduction to the electronic health records functionalities. We hope that you will find our clinical support functionality helpful. We are available at the following email addresses and look forward to providing any support that you may require. Thanks again.